This training module will cover the second shift protocol at Dayspring Village. Getting into a rhythm is important to the structure and workflow at Dayspring Village. The purpose of this presentation is to create structure around your daily work routines. Upon arrival, you will need to clock in using the time clock system. You'll need to obtain a working radio and turn off your cell phone or leave it in your car. Communication is vital in healthcare. It is important that if you have a question, please ask. From 2:30 to 2:45, this will be your time to focus on communications. First, you will check the Point-Click Care 24-hour report. Now, if you've just had your weekend, then you will need to check the PCC 72-hour report. This will enable you to learn what has been happening with each of the residents, and you can do this in a very short time frame simply by reading this report. It is much better to get this information from the PCC 24-hour report than to rely on word of mouth. The second thing you will do is to check your email for any assignments. The RCCs will prepare and send each staff member a list of assignments for that shift, and it's important that you take the time to check your email so that you know what your assignment is for that shift. Please know that you are responsible for both giving and receiving information. During second shift, there are multiple routines that co-occur. Your RCC will give you an assignment for your shift. Regardless of your assignment, please know that your work is both meaningful and necessary for the care of our residents. 2:45 to 4:30 is the perfect time to complete your personal care assignments. Following daily work routines will improve care for our residents, and it will help them to understand when is the time to make these particular requests. Personal care includes resident haircuts and shaving, providing assistance with showering, providing assistance with clothing and clutter management services in the resident living spaces. It is important that we understand that visitors will form opinions about the care we provide based on how our residents appear. The first shift will identify residents who are in need of personal care, and during this time frame, you will need to find these residents and provide the personal care to them. 4:30 to 5 is the typical lunch break. Lunch break must be taken on campus because Dayspring pays you for your lunch break. The lunch break is 30 minutes long, but please know that you must be available to assist residents as you are needed. If there is an emerging situation with a resident and you are on lunch break, we will expect you to assist with that emerging situation, even though you are on your lunch break. 5 to 7 is the time that we focus on medications and dinner. Medication compliance is critical to the care of our residents. Both the Med Tech and the Med Assist staff are responsible for a successful medication pass. And a Med Pass is only successful if all of our residents receive all prescribed medications. So you may either be assigned the Med Tech role or the Med Assist role. If you have been assigned the Med Tech role, make sure you do not have your cell phone in the med room. It is absolutely prohibited to have your cell phone in the med room for any purpose, as this is a distraction. Focus and concentration are key when you are providing assistance with self-administration of medications. As the Med Tech, you must strictly follow the infection control routines that are in place. They include disinfecting the med counter, washing your hands, and ensuring the area is secure prior to starting the med pass. Glucometers must be cleaned according to the manufacturer instructions after each use. And your hands must be disinfected in between each resident getting their medications. If a resident refuses to go to the med counter, the med tech must pull the blue box containing the medications and go to the resident's living space. You will then need to issue a PCC secure message regarding the resident's refusal to go to the med counter. If a resident is non-compliant with medication based on your observation, then you need to ensure that a PCC secure message is sent to the healthcare provider, the case manager, and the administrator. If the healthcare provider is not linked with point-click care, then you must make the phone call and document via a progress note that you have called them regarding suspected non-compliance with medications. If a medication is low and needs to be refilled, you must document with a PCC secure message to the Med Tech Conversation group. Medications are considered to be low when we have less than 1 week of supply. Now remember, sometimes a resident will receive a medication multiple times a day. And so you will want to take this into consideration when you determine if there is less than a week of supply. Record any source notes in your spiral notebook so that you can use them later as you are documenting your PCC secure messages or progress notes. Please do your part to avoid medication outages. It is much easier to prevent a medication outage than correcting one. Encouragement goes a long way with residents as it relates to medication compliance. So it will be necessary to provide prompts to residents. The target time frame is 6 p.m. to produce the first prompt list. You will give this to the Med Assist staff and ask them to locate these residents to prompt them to come to the medication counter. The second prompt list should be created around 6:40 p.m. Again, give the prompt list to the Med Assist staff so they can assist you in getting the residents to the medication counter. If you have been assigned the role of Med Assist, you will need to identify any residents who need their monthly weights and vitals taken. Use PCC to identify those residents who are missing this information. You are also responsible for ensuring that the day room and dining room TVs are turned to the local news. You will close down the main office to residents at 4:30 p.m. Unless there is an emergency, such as a resident crisis or a hospital transfer, the front office area should remain closed until the medication pass is completed. Everyone's focus between 5 to 7 should be on dinner and the medication pass. You can begin prompting residents as early as 4:50. Allow these residents who use walkers to come in and begin dinner, and any resident who is known to be a latecomer for medications, you can begin prompting them at 4:50. At 5 p.m. prompt, you will open the door to the dining room for all residents. As the Med Assist, you are responsible for marking attendance at dinner using the point of care module in PCC. Marking attendance at dinner is evidence of staff observation and monitoring, and it ensures that we are aware of the residents' whereabouts. As you are able, you are responsible to provide supervision in the dining area. The evening mealtime is a good time to gather monthly weights and vitals. Please know that clausural residents should have pulse rates checked every 2 weeks. The primary responsibility of the Med Assist role is to watch residents take their medications. You are also responsible for prompting residents to come to the medication counter to take their medications. 4 to 6 p.m. is the time for new medication entry into point-click care. Only approved staff with PCC access rights will be assigned this role. The process looks like this. First, medications are received by staff from the pharmacy. You must verify the prescriptions received to the manifest reported, and you must do this before signing, acknowledging that you have received them. So this means that the manifest will list what they are delivering, and you need to check to make sure that they are actually delivering everything that is listed on the manifest. Medications must be under video camera surveillance at all times, and they must never be left unsupervised by staff. If you must leave the area, then medications must be placed into the teal box. This teal box is only for new medications that have not yet been loaded into PCC. Do not place discontinued medications in the teal box. This is strictly prohibited. Discontinued meds need to go into the box labeled discontinued meds. The teal box is only for new medications that have not yet been loaded into PCC. And if you are entering in new medications into PCC, this should be done in the RCC office behind closed doors so that you are able to focus and concentrate on this task. This is an extremely important task, and it is important that your work be perfect. 6 to 7 p.m. is the perfect time to complete resident interviews. These interviews provide valuable information about the mental health of our residents. Interviews with the civil population include a 27-question survey. These surveys are done monthly. You will write the resident answers on the worksheet, and then you will type the question and the responses into a PCC progress note. Please be sure that when you are documenting what the resident said, that you use quotation marks to denote their response. You do not want to summarize their response. You want to capture it as closely as you can, word for word, and then document their response using quotation marks. Phoenix interviews include a 10-question interview, and these are done 3 to 4 times per week. It is important that we are constantly collecting information about our Phoenix residents so that we are ensuring that we have the necessary information regarding their mental health. These resident interviews provide evidence of staff supervision. For our Sunrise residents, progress notes are created via structured progress notes, and these notes must be completed daily by the Sunrise Care Coordinator and designated staff. We have lots of programs at Dayspring Village, as you can see by the chart in front of you. Monday and Friday, Brother Chuck Cooper comes for the Christian Life Ministry. Substance abuse class and Phoenix board games are held on Tuesday, Wednesday, and Sunday. Board games and Phoenix orientation happens on Thursday, and then on Saturday, there's another substance abuse class. So let's cover board gaming. Board gaming is divided into 2 groups for those nights, and the process is staff supervised and staff monitored. The goal of board gaming is to build adherence to rules, improve group dynamics, increase socialization, and improve concentration and cognition. If you have been assigned the task of supervising board games, then you will need to ensure that the board games have all the necessary parts. You will document participation in PCC Point of Care, and you will document any comments or observations in PCC Progress Notes. Finally, at the end of the board game, you will make sure that all of the parts for those board games have been packaged up properly. Substance abuse class occurs between 7 and 7:40. We only use the administrator-approved video and PowerPoint presentations. No other presentations are allowed. You must use the presentations that have been approved by the administrator. The substance abuse class is staff supervised and monitored, and the process is as follows. You will start the video, and then you will begin a prompt. You will ask a question, and then you will document the resident responses that occurred during that discussion. Again, you will try to document as close to word for word as possible, and then in your PCC progress notes, you will include those comments in quotation marks. So you document the resident responses, you will record resident attendance in the PCC Point of Care, and then you will prepare your documentation at the end of the class. Documentation includes the comments, observations, and feedback within PCC progress notes, and an email report with those comments and observations, and that will be sent to the administrator and facility manager. At 7:30, you may be asked to prepare the evening snacks. You will prepare those snacks and sandwiches for both the Max building and the main building. Please remember that when you are preparing ready-to-eat foods, you must wash your hands and wear gloves. From 8 to 10 p.m., we are dealing with medication pass and snacks. Again, you will identify those people who are historically late for meds, and you will prompt them to come early for meds and snacks. Also, residents with walkers, you will begin serving them early at 7:50. From 8 to 10 p.m., you will be dealing with the medication pass and snacks. The RCC should close the main office from 8 to 9 p.m. No residents or staff in the main office unless there is an emergency. Between 8 and 10 p.m., all staff should be focused on the supervision of residents and medication adherence. Again, a successful medication pass means 100% compliance with all prescribed medications. If during the 8 p.m. med pass you see that someone is low on their medications, you are responsible to adding that medication to the reorder list. Sound the alarm early if you see that a medication is low. During this time, you should also document any behavior issues, any resident request for assistance, or request to see Doug or their case manager. You will document this in PCC progress notes or secure message. And then finally, this is a good time for you to clean the assigned work areas. From 9:30 to 10:30, this is the time for documentation and follow-up calls. You are required to complete 4 progress notes during each shift. By taking notes in your spiral notebook throughout your shift, this documentation task will be easy. So you should prepare these progress notes between 9:30 and 10:30, and if there's any scanning of documents, you will do that also within this time frame. You will scan those into PCC documents. This is also the time for making follow-up calls to hospitals and then documenting with PCC progress notes what you were told by the hospital staff. And then finally, if you were given an assignment from the RCC via an email, you will need to communicate back via email the status of those assignments. It is important that we have two-way communication. If you are given an assignment, you must report back on the status of that assignment before you leave and end your shift. A couple of miscellaneous items that can be completed throughout the normal course of your shift. Make sure the silver gate is secured by no later than 4:30 p.m. And by 5:30 p.m., you'll want to make sure that the walkway lights have been turned on. If you see something that needs to be done, don't wait to be asked. Please do it. We've also started a self-serve laundry program. There's a sign-up list at the Max building for each day of the week. And then weekend laundry hours are from 10:30 to 6 p.m. Now, if a resident has not signed up for laundry, but you're able to work them into the schedule, by all means, work them in the schedule and let's build their life skills by assisting them with doing their own laundry. In closing, we want you to know that your work is important. If you see something that needs to be done, do it. If you're not sure about something, please ask. If meds are low, speak up. You must take your work seriously because lives depend on you. One of the most important keys to success is having the discipline to do what you know you should do, even when you don't feel like doing it.